Okay, so welcome to this next video in which we are discussing the drug treatment of rheumatoid arthritis. Okay, right. So we're in the process of discussing the pathogenesis of rheumatoid arthritis. Okay, right. So we've now discussed the structure of a synovial joint and the structure of a synovial membrane. Okay, right, so what's the starting point for rheumatoid arthritis? Well, basically, the starting point for rheumatoid arthritis is that you're going to get an autoimmune response against self-proteins, basically. Okay, and some of these self-proteins are going to be present within the synovial joint, within the synovium specifically. Okay, right, so let's discuss something called citrullination of proteins. Okay, so I just need to discuss what a citrullinated protein is before I can discuss this autoimmune response, because this autoimmune response is going to be directed against citrullinated proteins. Okay, right. So, basically, proteins are a polypeptide of amino acids, okay? And there are around 20 amino acids which can be used within polypeptides, okay? Now, one of these polypeptides that can be used is arginine. Now, let me show you the structure of arginine. So this is one that can be incorporated into proteins. So the structure of the amino acid arginine looks like this. So we'll start off with the core amino acid structure. So here is the amino terminus. Here's an alpha carbon with a hydrogen coming off it. Here's the carboxylic acid group down here. Okay, and then the R group of arginine, what you have is 3 methylene groups, which are here. So there's 1, and because I'm too lazy to draw 3, I'll just put brackets around and then put a 3 subscripted like that to mean copy this out 3 times, basically. And then you have a nitrogen coming off here with a hydrogen coming off it. Okay, and then a carbon here, and this is double bonded to a nitrogen, which then has a hydrogen coming off, and it also has an amino group coming off like so. Okay, so this is the structure of arginine, and this can be incorporated into proteins. So if this is our polypeptide here, so you have amino acid after amino acid after amino acid after amino acid after amino acid, some of these can be the amino acid arginine. Okay, now the single letter amino acid code for arginine is R. Okay, now there is a very related amino acid that is not proteinergic. It cannot be incorporated into proteins by ribosomes, which is called citrulline. Okay, and let me show you the structure of citrulline. Okay, so here is the amino group here. So it's an amino acid, so it's got an almost identical structure. It's got the core structure exactly the same as arginine. Okay, so here's the core amino acid structure. And then its R group, again it has 3 methylene groups like so. So here's 1, and I'll put brackets around like that and put a 3 there. And then you have a nitrogen here with a hydrogen off it, a carbon here, and then instead of having a nitrogen double bonded up here with a hydrogen coming off it, you just have an oxygen there, and then you have this amino group exactly the same. So all you've done is taken this group here off and replaced it with this oxygen here. Okay, now, citrulline cannot be incorporated into proteins by ribosomes. However, there is nothing stopping you making a protein which has arginine in, and then going over to this protein and converting the arginine into citrulline. Okay, and indeed this does happen. Okay, there is an enzyme which performs this conversion, and it is known as peptidyl arginine deaminase. So peptidyl arginine deaminase, which is usually abbreviated to PAD for short, deaminase. Okay, so all over your body, proteins will be having their arginine residues changed to citrulline. And when you take a protein and convert arginine residues to citrulline, the protein is then referred to as a citrullinated protein. Okay, Right, now this is occurring within synovial joints, basically. There are peptidyl arginine deaminase enzymes found in cells within the synovium. Okay, the specific two forms of peptidyl arginine deaminase that are found in the synovium are peptidyl arginine deaminase 2 and peptidyl arginine deaminase 4. Okay, so both of these are found within the cells of the synovial membrane. Okay, so proteins are being citrulinated. Now, what is the big deal with citrullination? Well, basically, when you change arginine residues to citrulline residues, it can completely change the tertiary structure of the protein. So, for instance, when you have an arginine, you might fold into some weird and wonderful shape like this, maybe. Okay, whereas once you've had it replaced by citrulline, it might fold completely differently now and look completely different. Okay, so citrullinated proteins can have a very different tertiary structure than the non-citrullinated protein, than the original protein. So, in the synovial joints, many proteins are being converted to their citrullinated forms, okay? And what's the significance of this? Well, basically, in rheumatoid arthritis, what is going to happen is you are going to initiate a humoral adaptive immune response against a citrullinated protein. At least it's believed, and I should stress that this is still very controversial. Rheumatoid arthritis is one of those diseases that isn't particularly well understood, not compared to others, okay? So this may well develop, but at the moment we think that the protein that you're going to initiate an adaptive immune response against is a citrullinated protein. Okay, so in the synovial joint, specifically in the synovial membrane of the synovial joint, you have a huge number of proteins. Some of them will end up citrullinated, okay? And these citrullinated proteins will have a very different shape. Now, what we think is going to happen is you're going to initiate an adaptive immune response against one of these citrullinated proteins. Now, we do not know which protein is citrullinated and you then initiate an adaptive immune response against it. We do, however, believe that it is a protein that has been citrullinated. So basically, there is some unknown protein, okay, in the synovial joint which is citrullinated, and then you're going to initiate an adaptive immune response against this citrullinated protein. Now, this is an autoimmune response. You should not initiate an adaptive immune response against a citrullinated protein. They are still self-proteins, and they should not have an adaptive immune response initiated against them. Okay, so let's start then the discussion of rheumatoid arthritis. So, basically, rheumatoid arthritis begins years and years before you ever start getting joint symptoms, okay? So there is what is known as a pre-articular phase, where basically you produce antibodies that are targeted against citrullinated proteins. And I need to emphasize something very important here, that the failure in immunological tolerance doesn't just happen for one protein which has been citrullinated. It happens for absolutely loads of them. Okay, so you seem to get some sort of failure of immunological tolerance. Okay, so you should tolerate citrullinated proteins, but you seem to get a failure of tolerance. And you start creating all sorts of antibodies targeted against loads of proteins which have been citrullinated. So it's not just this one protein in the synovial joints that has been citrullinated that you're going to initiate an adaptive immune response against. You initiate it against absolutely loads of different citrullinated proteins that are potentially present all over the body. Okay, so you're going to initiate a humoral adaptive immune response, okay, against many different citrullinated proteins, okay, a humoral adaptive immune response. And what does this overall result in the production of? Well, it results in the production of autoantibodies that are against all of these different citrullinated proteins. Okay, so let's say over here we have citrullinated protein 1, which could be any old proteins. I'm just trying to illustrate the point in as clear way as I can. Okay, so I'm just creating many different proteins over here, which are citrullinated proteins. So let's say we've got citrullinated protein 2 here. Maybe we've got citrullinated protein 3 over here. And maybe we've got the citrullinated protein that's within the synovial joints over here. Okay, maybe this is citrullinated protein 4, and this is the one which is in the synovial joints. Okay, so you're going to initiate separate humoral adaptive immune responses against all of them, and this doesn't just happen all at once. It happens gradually, so gradually you get immunological tolerance failing for many different citrullinated proteins, and it seems to specifically be for citrullinated proteins. It's not for any old protein. They have to, the characteristic that sort of joint characteristic that all of the autoantigens, as they're called, that are going to have autoantibodies produced against them have, is that they seem to be citrullinated. Okay, so something happens that means that suddenly you lose immunological tolerance for citrullinated proteins, and you gradually start initiating humoral adaptive immune response after humoral adaptive immune response against these different citrullinated proteins that are all over the body. Now, as part of the humoral adaptive immune response, there will need to be some sort of antigen presentation. You're going to have to present a fragment of each one of these citrullinated proteins to some CD4 positive naive T cell, and this will be done on the MHC class II molecule. Now, there is a specific allele of the HLA-DR MHC class II molecule that puts you at increased risk of having, suffering from rheumatoid arthritis, and maybe this is one of the things which is involved in the break in immunological tolerance against these different, for these different citrullinated proteins. So let me just explain a little bit more. So if we have our professional antigen presenting cell here, at some point what's going to have to happen is an antigen fragment of each one of these is going to have to be taken and presented to a naive CD4 positive T cell. Okay, now this will be done on a major histocompatibility complex class II protein complex. Okay, now there are 3 different types of MHC class II. Okay, there are HLA-DR type, DP type we'll start with, we'll do it in alphabetical order. There is HLA-DQ type, okay, whoops, can you see this? Yeah, I need to move this down a little bit. And there is HLA-DR type. Okay, so on chromosome 6, let me put this here, there is a locus on chromosome 6 which has genes which are needed to make HLA-DP. Now, people often do refer to this as the HLA-DP gene, okay, but in fact it's not a gene. It contains multiple genes because the MHC class II is not a single protein, it's a protein complex. It needs many different proteins, it needs 2 specifically, to join together to make it. Okay, so this HLA-DP locus here contains many genes for the alpha subunit and for the beta subunit. Okay, so if you use the instructions on the HLA-DP locus to make the alpha and beta subunit, you'll end up with an MHC class II of the HLA-DP type. Then further down there's the HLA-DQ locus. Again, this contains genes for the alpha and beta subunits of the MHC class II molecule, and if you use those genes in the HLA-DQ locus to make your alpha and beta subunit, and therefore to make your whole MHC class II molecule, you will end up with an MHC class II that's deemed to be of the HLA-DQ type. And then finally, further down, again, all on chromosome 6, and they're all pretty much next to each other. They do have introns in between them, but they are nicely next to each other. Okay, you then have the HLA-DR locus, and this again contains genes for the alpha and beta subunit of MHC class 2, and if you use those instructions to make your alpha and beta subunit for your MHC class 2, you end up with an MHC class 2 of the HLA-DR type. Now, in each of these gene loci, there are many different alleles that you can have present at each slot, basically. Now, one of the specific alleles that you can have in this HLA-DR slot is HLA-DR4. And basically, if you have HLA-DR4, you are 4 times more likely to develop rheumatoid arthritis. And the reason may well be, although this is pure speculation, the reason may well be that this HLA-DR4 is particularly good at presenting antigen fragments which have citrulline in, maybe. Okay, but this is of course all speculation and still controversial. Right, but HLA-DR4 being 4 times more likely to get rheumatoid arthritis is a empirical fact, basically. And I should have just said what HLA stands for. HLA stands for human leukocyte antigen. Okay, and it's the old name for major histocompatibility complex. Okay, so human leukocyte antigen. Okay, right. So you're going to initiate humoral adaptive immune responses against a whole host of citrullinated proteins. And as I say, this won't happen all at once. It will be a gradual process where one by one you start building up more and more humoral adaptive immune responses against more and more of your citrullinated proteins. Okay, now what does this result in the production of? Well, it's going to result in the production of antibodies, autoantibodies, directed against these different autoantigens. Okay, so against citrullinated protein 1, you'll get an anti-citrullinated protein 1 antibody. Okay, so let me just remind you of the structure of an antibody. Okay, so here is my picture of an antibody. So antibodies consist of 2 heavy chains. Okay, so here is a heavy chain here, and here is another heavy chain here. Okay, and the full name for this heavy chain is the immunoglobulin heavy chain. Okay, so another name for antibody is to call it an immunoglobulin. So immunoglobulins consist of an immunoglobulin heavy chain. In fact, they consist of 2 immunoglobulin heavy chains and then 2 immunoglobulin light chains. So this is an immunoglobulin light chain and this is an immunoglobulin light chain. Okay, so these are both immunoglobulin light chains. Okay, right. Now, the 2 immunoglobulin heavy chains are linked together by disulfide bonds, so that's that, okay? And each of the immunoglobulin light chains is linked to an immunoglobulin heavy chain, again by disulfide bonds. Okay, right, so this is the structure of an antibody. It consists of these 2 immunoglobulin heavy chains and these 2 immunoglobulin light chains. Now you can divide antibodies up into regions. Okay, so let me do this by circling things. Okay, so this portion up here, and you have an identical portion up here. These are known as the FAB portions of antibody molecules. And this means fragment, that's what the F is for, and then the AB is for antigen binding. Okay, so this is the portion which actually binds to the antigen. Okay, now, basically this has to have an exact structure which is complementary to a certain portion of this citrullinated protein 1, basically. And this is another important concept, that basically the FAB region, this antigen binding portion of this immunoglobulin molecule, it doesn't bind to the entire citrullinated protein. Okay, so it doesn't just grab hold of the entire thing. Instead, it will bind to a little portion of it. Maybe it binds to this portion down here, and the specific portion of the protein that it binds to is what's known as an epitope. Okay, so antibodies have these antigen binding regions which will bind to a specific epitope of the antigen. And I should just say that an antigen is just any protein which can have an antibody produced against it. Okay, so this entire structure here is an antibody or an immunoglobulin. Okay, so depending on which antigen you are targeting, and also depending on which epitope of the antigen you are targeting, you will have to have a very specific FAB region. This will have to have a very specific structure. So for instance, if we make an antibody against citrulinated protein 4, and I've picked citrulinated protein 4 simply because I can't now use citrulinated protein 2 or 3 because I've written all over there. So there wasn't any logical reason that I suddenly jumped from here to here. Okay, and we look at the anti-citrulinated protein 4 antibodies. Okay, so here again are the immunoglobulin chains. Then this FAB region here, the portion which actually binds to the antigen, this will be very different for the anti-citrulinated protein 4 antibody compared to the anti-citrulinated protein 1 antibody. But even we could produce different anti-citrulinated protein 1 antibodies. So we could produce another antibody here, okay, which is targeted against citrulinated protein 1, but binds to a different epitope of it. So maybe there's a little bit that sticks out here, and this other anti-citrulinated protein 1 antibody is going to bind to this different epitope here. This again will have a very different FAB region here. Its antigen binding site will be very different. Okay, so it's not as though all antibodies which target the citrulinated protein 1 will have exactly identical antigen binding sites, because they could bind to different epitopes. So you will get variation there, basically. Okay, and of course the antibodies which are binding to totally different proteins, those are definitely going to have different antigen binding sites from the anti-citrulinated protein 1 antibodies. Okay, right, so that's the FAB region of the antibodies. Now, all of what's left, you have these two identical antigen binding sites, and all of what's left of the antibody molecule is what's known as the FC region of the antibody molecule, and this stands for the fragment crystallizable. Okay, now when you produce an antibody, firstly you have to decide upon your variable region, which is, well, your antigen binding region. Okay, so this has to be decided upon first, but then you also get to decide upon this FC region. Okay, so there are many different FC regions you can use. Specifically, there are 9 different FC regions that you can use. Okay, so how do you produce these different FC regions? Well, let me just discuss the structure of the immunoglobulin light chains and the immunoglobulin heavy chains. Okay, so let me pull out an immunoglobulin light chain here, and also an immunoglobulin heavy chain. Right, so both the immunoglobulin light chain and the immunoglobulin heavy chain can be divided into 2 portions. Okay, so this portion which is involved in making up the antigen binding region, this is known as the variable region. Okay, and this is the region which needs to vary in order to make different antigen binding sites for different antibodies, okay, which are going to target potentially different proteins or maybe just different epitopes on the same antigen. Now, of course, you will produce loads of copies of a single antibody that has a certain antigen binding site, but you'll also produce many different antibodies that could be targeted against different epitopes of the protein. So it's not as though, you know, if I sample your blood, you're only going to have one molecule of each antibody in. No, you'll have loads of copies of this one, but you'll also potentially have loads of copies of this one. Okay, so the variable regions of the immunoglobulin heavy chain and the immunoglobulin light chain, those are what will vary between antibodies produced by different B cells, basically. Now, you then have these constant regions, okay? So the two lower regions, which are involved in producing the Fc region, these are what are known as the constant regions of the immunoglobulin heavy and light chains, okay? Now, it's a bit of a misnomer, at least for the heavy chain it is. For the light chain, it truly is constant, but for the heavy chain, there is actually variation, basically. There are 9 different constant regions for the heavy chain that you can use, okay? So let me list these out. So there is the constant mu region, there is the constant delta region, there is the constant epsilon region, there is the constant alpha 1, the constant alpha 2, the constant gamma 1, the constant gamma 2, the constant gamma 3, and finally the constant gamma 4 region. So these are the 9 different immunoglobulin heavy chain constant regions that you can use. Now, depending on which of these constant regions you use for the immunoglobulin heavy chain constant region, will determine what type of antibody you are deemed to be. Okay, so if you use, for instance, the constant mu region, then you are called an immunoglobulin M antibody. Okay, M is the Latin equivalent of mu in the Greek alphabet. Okay, if you use constant delta, you are how am I going to rectify that? IgD. Okay, D is the equivalent of delta in the Latin alphabet. Okay, and if you use constant epsilon, you are an IgE antibody. Okay, either of these constant alpha 1 or constant alpha 2, you are IgA. Sometimes people will distinguish between the two different constant alpha regions, and they'll call constant alpha 1 IgA1 and constant alpha 2 IgA2, but often they're just all grouped together. Similarly, for the 4 constant gamma regions, these are IgG. Okay, and again, sometimes people will distinguish between them. So if you use the constant gamma 1, you might be referred to as an IgG1. Constant gamma 2, you might be referred to as an IgG2. Constant gamma 3, you might be referred to as an IgG3. Constant gamma 4, you might be referred to as an IgG4. Okay, so there are these 9 different constant regions of the immunoglobulin heavy chain, and depending on which one you use will determine which immunoglobulin type you're deemed to be. Now, the main one that you'll end up producing are IgG molecules. Okay, so you're going to produce antibody molecules which will mainly be IgG against your citrullinated proteins. Now, these will then be circulating in the bloodstream, and they are all collectively known under the umbrella term ACPA, which stands for anti-citrullinated protein antibodies. So this is anti-citrullinated protein antibodies, because all of them are directed against specific citrullinated proteins. Okay, but they're all, the common feature that they all seem to have are that they're directed against citrullinated proteins. Okay, so ACPA stands for anti-citrullinated protein antibodies, and this is occurring potentially years before you ever get joint symptoms. So years before you ever get synovitis, which is inflammation of the synovial joints, specifically of the synovium. Okay, you are producing anti-citrullinated protein antibodies. You're producing antibodies which are directed against epitopes of these citrullinated proteins, and you're doing this against loads and loads of different citrullinated proteins. So you're gradually building up your repertoire of anti-citrullinated protein antibodies, and at some point what happens is that you start producing an anti-citrullinated protein antibody that is specifically against a citrullinated protein that is found in the synovium, and we agreed that that was going to be citrullinated protein 4 here. So it might not even be the first one to be produced. You might produce antibodies against citrullinated protein 1 first, And then you might go on and develop an autoimmune response against citrulinated protein 2, then citrulinated protein 3, and then finally citrulinated protein 4. Now, the question is, the instant you produce anti-citrulinated protein 4 antibodies, are you going to develop rheumatoid arthritis? And the answer is no. And the reason is that citrulinated protein 4 is safely within the synovium. Okay, so it's within the synovium here, the synovial membrane somewhere. Whereas the anti-citrulinated protein 4 antibody is within the blood. And it can't just get out of the blood. It can't just, pass across the endothelial cells and go into the interstitial fluid of the synovium. No, no, no. It can't. The reason that antibody can get out at the site of a pathogenic infection is that you've had a massive, great innate immune response at the site of a pathogenic infection, which has led to huge inflammation there already, and all of the blood vessels are leaky and allow the antibody to leave. That's how antibody gets out when we usually talk about the humoral adaptive immune response. But now you've produced this antibody against a protein that's at a site where there is no inflammatory response occurring. Okay, so it cannot get out of the blood and get into the site where that protein is, because in order to get out of the blood it requires the blood vessels to be leaky, and therefore it requires an inflammatory response to be occurring at that site in order for the anti-citrulinated protein antibody to get out. So in order for you to transition from the pre-articular stage, where you have no joint symptoms, to the articular stage of rheumatoid arthritis, what you need is some excuse, basically. You need some inflammatory response to occur within the synovial joint that just happens to now expose the fact that you've got this autoimmune response, because it's finally now going to let the antibody go from the blood into the synovium, and then it will trigger off rheumatoid arthritis. Okay, so basically, in order to actually get transition from where you've just got this autoimmune antibody circulating within the blood to the stage where it's actually causing a pathology in the synovium, you need some sort of inflammatory response in the synovium to happen anyway, which will then allow the antibody to get out of the blood into the synovium and trigger off the rheumatoid arthritis. Okay, and we'll discuss the transition in the next video.